Hello. Thank you for joining us today. My name is Ann Elwell, and I am the Director of Quality Improvement at Qualidigm. We are so pleased to be able to offer this heart failure educational video to you. Qualidigm is a private, not-for-profit, nationally recognized health services research and consulting company located in Connecticut. Qualidigm is also the designated Quality Improvement Organization, or QIO, for Connecticut. We are charged with protecting the rights and ensuring the quality and safety of care provided to all Medicare beneficiaries throughout our state. There is a QIO-like entity in every state and U.S. territory. For nearly 2 years, Qualidigm has been working with the Connecticut Hospital Association and many of Connecticut's acute care hospitals, nursing homes, home care agencies, physicians, and other healthcare providers that share patients. Our goal is to reduce preventable readmissions to the hospital for patients with heart failure. We call these groups of providers communities of care. About 27% of patients with heart failure are readmitted to the hospital within 30 days of discharge, and many of these hospitalizations could have been prevented with better education of staff, patients, and their caregivers. The Education Committee, a group of volunteers from the communities of care, have therefore worked to address the issue of patients with heart failure and their caregivers receiving education that is redundant, inconsistent, or inadequate. Through funding provided to Qualidigm from the Centers for Medicare and Medicaid Services, we have developed a series of 3 educational videos focusing on heart failure, one for licensed staff, nurses, physical and occupational therapists, pharmacists, and others, one for certified nursing assistants, and one for patients, their families, and their caregivers. The purpose of these videos is to inform healthcare providers about the medical management of heart failure, and mainly to promote self-management by patients and caregivers. The patient videos were created at an appropriate literacy and health literacy level. They provide the basic recommendations to keep patients healthy and safe and hopefully out of the hospital. We are pleased to share them with you and other healthcare providers throughout the country. It is now my pleasure to introduce Dr. Jason Ryan, a cardiologist and assistant professor of medicine at the Yukon Health Center. Dr. Ryan is also the chair of our Community of Care Education Committee. He has graciously volunteered his time and expertise to develop this video series. We thank Dr. Ryan and you for watching today.
Welcome to Heart Talk, teaching your patients to live with heart failure, evidence-based care for the healthcare professional. These videos were made possible by funding from the Centers for Medicare and Medicaid Services to help nurses and other healthcare practitioners improve the lives of patients with heart failure. The videos have several key purposes. First, to review the science of heart failure. What is this disease? How is it treated? Healthcare providers who understand the science of heart failure can more effectively teach their patients to live with the disease. Second, we'll review the evaluation of a heart failure patient, how to use the history, physical exam, and other information to determine a patient's fluid status and guide therapy. Next, we'll review 6 key recommendations that should be made to all heart failure patients so they can stay well and stay out of the hospital. Then we'll review some of the most effective techniques for communicating with patients so they comprehend and retain information about their disease. And finally, we'll discuss palliative care and end-of-life issues for heart failure patients. These videos are conveniently broken up into 5 modules: the science of heart failure, evaluating patients with heart failure, recommendations for patients, how to teach your patients and promote patient self-management, and palliative care. The modules can be viewed separately or together as one, and they can be viewed multiple times. I'd like to thank you for viewing our Heart Talk videos. We hope you'll find them educational and engaging. We hope to help you better care for your patients with heart failure. Let's get started.